go over some numbers. Unfortunately, we lost another individual in the county to COVID-19 over the night. It was a Caucasian female in her 90s. And then it appears we may have lost 3 individuals to nursing home deaths over the last 24 hours. Again, related to nursing homes, we don't have the information that we do related to hospitalizations. So certainly want to think about their families, and we grieve with you, and certainly we grieve with everyone over this process. The other day at a briefing, an individual, we talked about Stella Corona, who was 102 years old, and we lost her and her family, but a woman's name was brought up that did not die of COVID-related issues, Stella Vallone. And so certainly her family reached out to me and wanted to clarify that I was asked a question about her, and I did not know if it was the same individual or not, about different last names. But certainly Ms. Vallone lived a long, full life, and but she did not pass away related to COVID. So I just wanted to clarify that. Related to testing and new cases, 32,855 tests have been taken now. 31,917 tests have been returned. 1,908 returned since yesterday. And we now have 1,973 positive results. That's 14 new cases and 28,050 negative results. We have sent 1,431 tests. We have 938 pending tests. 6.2% of the results we have received have been positive. That number is, again, since March when we started testing. That number when we were doing symptomatic testing between 8 and 8.4%, going down now as we thought it would as we test asymptomatic folks without symptoms. And anybody can get a test, so that's driving the numbers down. Over the last 3 days in the New York State Department of Health system, we've averaged 1,010 results in the eClair system per day. So that's how many tests have been coming back. Our infection rate on a 3-day average is at 3%. So the infection rate going down. Universal testing at the Syracuse Community Health Center site, again this week and next week as well. We've also been doing our mobile testing. Today we are testing at the Lafayette High School as we speak, getting some numbers from our southern towns. Not a lot of cases reported to date in southern towns, so we wanted to go there and get more information. Tomorrow we will be testing at the Syracuse Community Health Center at 1938 East Fayette Street. This is not the triage testing site. It's on East Fayette Street. And then Friday we will be testing at Valley Plaza down in the valley on Salina Street by Seneca Turnpike, right before Seneca Turnpike if you're going south. Next Monday we will be testing at Clay Central Park on Wetzel Road in Liverpool. So we're going to be in our northern suburbs on Monday. And then on Tuesday we will be at West Genesee High School in some of our western towns. So again, we're taking our mobile testing lab. We're going to various pockets of the community to offer up testing, whether symptomatic or asymptomatic testing. If you want to go and register online for any of these sites, you can go to our health department's website and register and get a time. Our regional testing data, again, on average, 775 tests a day on average. 7-day average is what we look at. Yesterday, we had an awesome day of testing, 2,621 tests. So more than 3 times what is needed. Made up for a couple soft days over the weekend. So good job to all of our partners. Chairman Hyder in Cortland County, Chairman Becker in Madison County, Chairman Weatherup in Oswego County, and Chairwoman McNabb Coleman and Cayuga. Thank you for all your help with this. You're doing a great job. Our daily average right now, 1,206 tests for the region, May 20 through the 26th. Certainly well over our mandate. Related to hospitalizations, we're now at 77, down 8 from yesterday. Very good news. Again, out of these 77, we have, I believe the number is 40 today. 40 of these individuals have yet to test negative for COVID, so therefore they cannot go back to a nursing home. We believe we have a solution for some of these individuals who no longer need hospital care. We'll hopefully have that solution available to talk about tomorrow, and that will, again, 77 minus 40, we really have 37 people right now in the hospital that need the hospital care. So that number is a very good number. One of best number. We didn't even have that number going into phase 1, and now we're going into phase 2. 14 in critical condition, down a little bit, but still within our ballpark. We've had about between 15 and 20 individuals in critical condition throughout really the last month, maybe even a little bit longer. Again, please think of these individuals. These are our neighbors who are in a fight right now. So let's think about them and wish best wishes to them and their family. To date, we've had 235 people that have been released from our hospitals. They've gotten better. It's good. And so overall, related to positive cases, up 14. That's our best day we've had in a while. Again, we were a little surprised by this. We didn't have as many cases come back, as many tests come back, so we don't want to get too ahead of ourselves on this number, but we'll celebrate for the day at least. Out of the 14, 2 household contacts of previously confirmed cases, 9 senior-related cases, 3 community spread. So certainly the community spread number is an awesome one. Let's hope that we continue to see trends and numbers closer to this than we have before. Still, related to asymptomatic cases, we are seeing a trend in senior-related facilities with this new testing mandate that they're going through, that workers are asymptomatic. 14 days is what these folks go into an isolation period for. So certainly we're watching this with our employees at our nursing homes and assisted living facilities very closely to make sure that if there becomes a workforce shortage, we're able to coordinate to make sure that these individuals get good care. So that's something that we're watching for. Looking at recoveries, plus 24, so 1,034 people have recovered. That's up 24 from yesterday. Active cases, 814. That's down 14 from yesterday. So right now we have 1,922 people in isolation and quarantine. And again, just to touch asymptomatic cases, 53% of the 3-day average are asymptomatic cases. So for those of us who think, we can't think and be too comfortable right now where we are, even though the numbers are getting better. People who are showing no effects of the virus are sick and can spread it. So even if they're not showing symptoms, they're contagious at this point. So please continue to be diligent with your health. The numbers reflect that you are being, but we still need to be really cognizant of this virus because we see what happens and how lethal it can be. 1,170 of our cases have been female, 803 have been male, 86 under the age of 19, 330 in their 20s, 244 in their 30s, 244 in their 40s, 315 in their 50s, 254 in their 60s, 196 in their 70s, 185 in their 80s, and 119 in their 90s. City of Syracuse, 193 total cases, 523 recoveries. Clay, 154 total cases, 107 recoveries. Onondaga, 133 cases, 38 recoveries. Geddes, 104 total cases, 30 recoveries. Salina, 86 cases, 57 recoveries. DeWitt, 73 cases, 53 recoveries. Manlius, 70 cases, 55 recoveries. Cicero, 64 cases, 37 recoveries. Camillus, 61 cases, 38 recoveries. Lysander, 37 cases, 27 recoveries. Pompey, 26 cases, 22 recoveries. Van Buren, 25 cases, 9 recoveries. Skaneateles, 15 cases, 15 recoveries. Lafayette, 7 cases, 3 recoveries. Marcellus, 7 cases, 6 recoveries. Elbridge, 5 cases, 2 recoveries. Atisco, 5 cases, 5 recoveries. Spafford, 3 cases, 2 recoveries. Fabius and Tully, both with 2 cases and 2 recoveries. A couple updates related to Restart. We've put guidance up on our health department website related to high school graduations. We continue to communicate with all of our schools on what graduation could look like in different phases. Related to our libraries, yesterday we had a very successful opening. Over 200 requests for material to be taken out. Every city branch and the central branch has had takeout orders fulfilled. Again, we're doing takeout right now related to our library system. We're assessing that. At some point we'll continue to do takeout, and then we'll bring in hours for specific groups. Think of groups for seniors, think of groups for children, etc. And then eventually we'll get to the point where we have the libraries opened up again. Also, a couple numbers, and then clarify one event from yesterday, and then take questions. Child Care Solutions, 315-446-1220. Believe it or not, even though we talk about this every day, we still get calls and questions related to child care. This is our daycare program. We have slots available free of charge for essential employees through the month of June. We'll reassess where we stand with child care, whether the program will be expanded. 211 for social and emotional support. Certainly this has been a trying process for all of us, and if you need help, please contact 211. And again, yesterday there was some reporting related to our comments. There's like a little bug here. We get that on bloopers highlight film after Chris Baker. You can get that. But they're related to what we're calling restaurant seating. What we've been advocating for this to the state is in phase 2 to open up restaurant tables outdoors for waiting services. That's what we're advocating the state. There was a situation where one restaurant, I read about it after, didn't open up seating. They just had seating outside. People took takeout, and the takeout, they went and they sat outside with their food. There was some confusion with our health department related to that. We've talked, and I talked to Dr. Gupta, and what we're going to do is we're going to give guidance to restaurants that are doing takeout related to their outdoor seating. And certainly there is no difference between buying an ice cream cone and sitting down at a stool outside of an ice cream shop and doing the same thing at a restaurant. But that's not a green light to go add many seats so that you can have some sort of blend. So I'm working on some direction with our health department so we can give that direction out to the restaurants. Dr. Gupta and I talked about this today, and certainly we both think that phase 2, having some sort of outdoor service available for restaurants makes sense as you go into phase 3, where you'll bring back more density in that business. So hopefully that brings some clarification onto that chain of events that happened last night. And questions?
Would you go through the latest deaths in the past 24 hours and where they occurred?
1 in the hospital. Appears from the state website, 3 in nursing homes. Again, I'm always, it's not my information. I don't know how it's compiled, and I can't verify if it happened in the last 24 hours or not. But those were 3 individuals, 3 of our neighbors that have lost their life at some point in time in the recent future at a nursing home.
So 127 total would be your data?
Yes.
On the positive test, we got 14 positives out of I don't know, maybe 1,900 tests or somewhere around there.
Yep.
Do you have an explanation for why? I mean, that's the lowest number of positives we've had in over a month. Do you have any idea why it's so low?
Yeah, I don't, other than, I think the day before we had solid community spread numbers. We had 70 for 2 days over the weekend. You had 70, I think 6 combined. I think before that you had higher numbers. But if you think about it, and maybe I'm so close, I think I see something, I'm too close to it, but we've tested all the nursing home residents the state of New York essentially has. That's been driving 2/3 of our numbers. We tested the residents in affiliated senior facilities because we knew that there was cases there and we wanted to hunt it out. We've been testing the employees now. So if 2/3 of your caseload has essentially been already assessed and tested, and you haven't been allowing new visitors in, one would think that you mitigated all that risk. And now what we're seeing is most of these positives coming out of these facilities now are asymptomatic employees. So if we've already gotten through that part, and that's what drove up our numbers the way it did, now we're really assessing the community spread and asymptomatic. So in theory, our numbers should be coming down because the spread for a period of 6-8 weeks has been within 10 and 20 on average. So maybe I'm too close and I'm being too optimistic, but I hope the worst of what we lived through related to our nursing homes and assisted living facilities for seniors is over with. And that's why that should bring the test load positives down, and maybe we'll see this trend moving forward. That's what I'm hoping.
I know you
Go ahead.
I know you touched on Sky Armory before. We just spoke with them today. They said that they're planning on opening for phase 2. They think that they can do that. They said that they won't have any big crowds until July, but they are planning to have about 250 people in mid-July for an event. They said they don't have to listen to social distancing rules because they have a really good plan in place as far as tracers and spraying down everything. What do you have to say about that?
I don't really have a comment on that. I don't think they don't do tracing. That's what we do at the health department. So I don't know enough about what else their business does, if they fall under a professional service or not related to phase 2. So maybe they do. I don't know enough about their business. I do know that there cannot be large weddings in phase 2. And physical distancing this isn't a fad that we can choose to just stop doing right now. It's what's helped us get to the point where these businesses can open up again. And so I'm not going to comment further on what they're doing and what they can offer. If they're a professional service and they fit under that, that's fine. This may fall into that category we talked about, a business that the majority of their business is something that is in a phase 4 scenario, but maybe you can do certain things in phase 2. We were advocating for those scenarios, or those utility type scenarios where maybe they can do something and generate revenue in phase 2 that meets guidelines, but the majority of their bulk and business comes later on. I hope that's the case for them.
Is it becoming, and you used this phrase before, the wild, wild west in terms of reopening? You have a restaurant that did outdoor seating out of phase without the approval from the county, without the approval from the state. 24 hours later, they're given the approval by the county retroactively. You have other restaurants waiting to do the same, but waiting for an explicit green light. I mean, at what point does a business start something, try it, see if they get yelled at? It just seems like it's kind of open to interpretation, and it seems like there's a lot of gaps.
Yeah, nobody's done this before. So I don't know if we're in the wild, wild west yet, but one can make an argument we're moving west. And I think my understanding is guidance on phase 2 is going to either be out tonight or tomorrow. And so that will create the platform for these businesses to attest. And then do their plans, keep their plans in their office in case we have to come via complaint on a regulatory call. But certainly, I don't envy, and again, what we advocate for to the state, if there's something that is regional in nature or best handled at the local level, just let us handle it. And we advocate for that in these calls that we do. And, you know, it's really going to be everything we do in coordination with Dr. Gupta and the health department, because if there's any sort of outbreak or an uptick, we're doing the work anyways, my operation. So if you think of it that way, it's in our interest to make good, smart, data-driven decisions like we have been. So I think as we get into these other phases, phase 2 is going to be the hardest. It's going to create density. It's going to, we're going to be ready with more and more contact tracers ready to respond. But you need to give the business community more direction. I can't tell you how many emails I've gotten from various groups asking where they fall, and I don't have the answer for them because I don't make the answer. So if we're not going to give more time for the business community to prepare, then I think we need to let the locals make more of these decisions because we eventually do all the work related to it anyways.
So without those answers, should they just try it and go ahead, or would you tell them to wait for an
No. I mean, look, everybody can figure out. There's very few industry that doesn't know what phase they're in. There's very few that can make the argument, I might be phase 2 here, phase 3 there, and phase 4 here. So I enjoy the creativity of some of the private sector and the innovation on trying to find yourself in a different phase if it suits your needs, and I appreciate the frustration. That's why we're advocating so much to try to find this. Gyms. How many people thought of allowing personal trainers to open up one-on-one, 6 feet apart before, other than your county here, trying to figure out how to get things done for gym owners to get a little bit of revenue. Sky Armory may fall into that. Maybe they have a professional service that they can do a little bit of business in phase 2. Certainly massage therapists, you know, we think phase 2, right? We're advocating phase 2. There's so many different things that we're trying to advocate for where it makes sense, but all those conversations we have are with our health department so that Dr. Gupta and I are on the same page, and then we go to the state. And at some point, if we don't get answers from the state, we have to make a decision on our own what we're comfortable with, and I've proven I'm okay to do that.
But if Joey's can serve at its tables, I don't mean serve.
They don't serve.
Yep, I know.
Yep.
If Joey's opens up its outdoor tables tonight, can other restaurants open and use outdoor tables tonight, tomorrow, before phase 2?
If they're there right now, and they're not using them, the patron decides when they're leaving there they might want to sit down and eat some of their food. Can they do that with 10 or more people? No. Physical distancing rules are there. We're going to give very good guidance on this by the end of the week so that the businesses can. But what we have asked the state to consider is allowing outdoor service for outdoor seating for restaurants in phase 2. Right now, if you have no tables outside, you cannot go and put up 20 tables so that there can be some sort of blend between that yet. We want to get you there, and we're advocating to get you there. Phase 2 is Friday. But we need to hold our horses, is what my mother used to tell me sometimes.
My mom has said the same thing to me. But what do you say to the businesses that have been waiting for the green light and now seeing other businesses just going ahead and doing it?
There is no competitive advantage for what happened with Joey's. Zero competitive advantage. There was tables. Some people took tables and took pictures on social media. Syracuse.com found out about it before. I didn't know about it if I didn't read Syracuse.com's article. So that there was a competitive advantage would have been they were serving food there and they were taking orders there, and therefore they had an advantage over other restaurants because people wanted to be outside on a nice day, so they went to that business. We don't view, again, we're going to give guidance on this, but there's no difference between somebody walking outside of a restaurant, sitting at a table, than with an ice cream cone at an ice cream store,
But
or
there are
going into a
restaurants that
county
have
park.
chosen not to allow that because they never got approval for it.
Nobody's gotten approval for that, except for right now when we're giving them guidance. But they're not, but Andrew, you're missing the point here. There's no advantage to it. So there's no discrepancy here, really. Them having the ability for people to sit at a table outside after they already bought a product brought no advantage to them where they could market that. So the other businesses don't have a gripe other than the fact that we're going to make sure that anyone who has a table outside, if their customers on the way out want to sit there for a couple minutes, that's fine. We're going to give guidance on how that operator then has, that's more of a liability for the operator, actually, not a benefit, because now the operator, we're going to make sure that the operator has to follow proper healthcare protocols to make sure that the proper cleaning is done outside. So this didn't help their business because now they have a larger mandate. Now, if we get what we want and they can open up outdoor seating for restaurants going into phase 2, Saturday, probably wouldn't be done ready on Friday if we got that, then that's a different ballgame and they all have that advantage.
One more question, then I'll move on. I'm sure your Facebook commenters are mad at me for staying on one topic. A lot of these businesses feel that their state liquor license is probably the most hurtful enforcement the state can impose on them. You allowing this for Joey's and other restaurants, can you speak to protecting their state liquor license if they do something the state hasn't approved?
They're not doing anything the state hasn't approved. What we're clarifying is that there is a table outside of their building. A customer goes in, they buy a chicken parm from Joey's. It's delicious. They then go out, instead of going to Onondaga Lake Park to sit there and watch the beautiful sunset, they decide to watch it from Joey's outdoor picnic table in the parking lot. They did not serve alcohol. They did not do anything wrong. So the analogy is apples and oranges. If we were to say to Joey's, you have, from Onondaga County, permission to wait on tables and serve alcohol outside of the state of New York, they are risking their liquor authority in that example, not the first.
The only story, so I did the story with Heritage Hill. They pitched you a plan to offer outdoor seating.
Phase 1.
Or later phases. They wanted some clarity early on when they could open.
Yep.
They were waiting for an approval and never got it, but you have a restaurant going out and doing it on their own anyway.
Yeah. Look, we're not going to go in a tit for tat with different restaurants and what they may or may not be doing. We'll give guidance on how people can allow customers on takeout to sit at picnic tables.
Frank, going back to guidance from the state for phase 2, you said you think it'll come later tonight or tomorrow.
Yeah.
This is the second phase now where we've had to wait until 24 hours before the phase starts to get detailed guidance from the state. We've got 2 more phases. I assume you don't want to go through the same thing again where you're getting emails, calls with people wondering what's going to happen when this phase starts. So what are you doing to make that happen as part of this regional control group to speed that along?
It's a consistent, every day on our calls, this is a topic that gets brought up about getting the guidance out sooner, letting the attestations happen sooner, so that in the event there is something that the state wants to see related to different protocols or health protocols that industry hasn't been used to, they can then adapt to it sooner than later. And so we're pushing them. I think our reps on the call would like to see it happen sooner as well. It's not them physically doing this. And again, sensitive to a point related that nobody's had to do this before, although we've had our phases now pretty ironed out what was what for a period of time. So certainly we would like to see the guidance come out sooner than 24, 48 hours before.
Do you know what the delay is?
I don't, other than I'm making assumptions that it is a lot of work, and I don't know what the staffing levels are at the Department of Health in the state right now or whatnot. You could have logistics challenges, as I know we're at a skeleton crew in our own county government, dealing with more work and more demands on us than we have in previous times. So
on those calls, have you discussed Friday being the day? Because we were talking before this that May 15th was pretty much circled on everyone's calendar, but since then it's been kind of ambiguous 2 weeks.
I think did we start on May 14th? Or
It
was
would have been
15th?
Friday
Yeah.
at 12:01 a.m. on the 15th.
Yeah, okay, yeah, so Friday's the day. Friday's 14 days. So that's,
And we've got the go-ahead, like we're good to
look,
go.
Friday's going to be the day. We've had these discussions on our calls. I don't know from the state side how they plan on rolling out phase 2, but this has been a data-driven process. We heard the governor talk about it every day, and the data is clear. The process has been, I think, 2 weeks is what has been written about. I think the governor has given the ability potentially to even move that sooner if the data shows that in future phases. But there's been no talks about extending 2 weeks, and our hospital numbers are stronger than they were in phase 1. Our community spread numbers are on par with the weeks before phase 1, and even our assisted living senior numbers related to positive cases has gone down in this phase 1 compared to before phase 1. So there are no metrics to slow us up from Friday.
Do you know if Destiny USA is planning to reopen Friday, or just that they'd be eligible to reopen?
I don't know what they're planning. I know that I'm sure that's a decision they have to make, and they would probably need enough demand from their tenants. So I'm not sure. Their retail's open in phase 2.
They've given you a plan. What can you tell us about the plan?
I didn't review the plan. Any entity like that, it's not what I think about the plan. It's what Dr. Gupta thinks. They gave a plan. Dr. Gupta reviewed it. She made recommendations to them. I'm sure they'll take those recommendations seriously and implement it.
How about the 2 other malls?
Shopping
Town,
yeah, I think Shopping Town. I just got off the phone with the guy. They got a great plan. Obviously, a booming metropolis of activity out there. I'm joking for all those who don't know the history with me in Shopping Town. I've not seen Shopping Town's plan. I'm not sure what still exists there. And Great Northern, again, we have not seen their plan. Not as much of a retail hotspot that even some of our town centers are.
There's a big screen going up in the orange lot. Do you know what that's for? Is that for any graduations or?
A screen?
Yeah, it's like somebody's building like a big movie screen or whatever you use for.
Yeah, so the orange lot is, we have a lease on the orange lot related to amphitheater concerts for dates. Other than that, the New York State Fair owns that lot. So I'm not sure what Troy Waffner has planned there, but
Okay.
I'm interested now.
Yeah.
I'm very curious, so you'll have to keep me informed. But that's why you've seen the pizza-free, little operation going on there. I think they have a competitor now at a different location now. These operations are picking up neat little ways to get that fair-type feel. But again, the state owns that lot. We lease it from them via the amphitheater season, so I'm not in charge of what goes on up there, but I'm very curious now. You'll have to let me know what you find out.
What kind of complaints have you gotten about businesses in the last 2 weeks that you've had to respond to, check out?
Yeah, so there's a couple businesses that may have been operating out of phase, so we've dealt with some of those, and certainly we get. Right now, we're fielding there's a lot of anxiety with some employees now that their business may be starting up in phase 2 or phase 3. And so they're concerned because one of the things with the employment benefit that folks got, that extra, I think, $600 a week, a lot of people actually make more money now in unemployment than they do going back to work. And so these employees are concerned that if the business opens up in phase 2 and they don't return, they'll lose that benefit, which they will. That was never meant to be a permanent benefit. So we're getting a lot of those types of complaints, a lot of anxiety from employees related to unemployment, a lot of them related to they're nervous about just their job. We hear a lot from dental hygienists who, if you look at the jobs that at-risk type jobs outside of our healthcare workers, dental hygienists, certainly front lines with this virus. So we hear a lot now from that level of anxiety about restart in certain fields. But the complaints haven't been that crazy. We've had a couple businesses that were certainly operating out of order, and we went, talked to them, and for the most part, it's understanding that they are now waiting to the right phase.
Yesterday we talked about churches. You were looking for some guidance from the state. Any update on that?
No, I was told that it's being looked at. Look, that's one of those calls where if we got the federal and state saying two different things, on game day I'll make my own call.
What will that call be?
If we don't hear anything from the state or the feds we heard from the feds, right? So the federal government says they're essential. Essential means 100% capacity to me. That's concerning to me. We've asked the state. The state said 10, and the feds are saying everyone. So really at two different things. So we asked the state to consider 25% capacity related to the buildings themselves. Certainly the state's allowed for outdoor type services, but if, on Friday I'll have a decision to make if there's not specific guidance being updated from the state. Because my concern is, Chris, is that there's going to be churches, if we don't give them specific guidance, there will be religious institutions that will have more than 10 people in them, potentially much more, on Sunday. And I think if we give them specific guidance, about 25%, then they'll follow that guidance. And from a public health standpoint, I know that our health department's much more comfortable with that.
You closed the bathrooms and everything at the parks before. The other day I noticed that some of the bathrooms were open. Have they all reopened?
I think we've opened up the church. That's an interesting question that you're asking about. All the bathrooms that are now open in all the parks. You must be going to the parks a lot. So we received a lot of complaints about Onondaga Lake Parkway, no bathrooms being open. We did that on purpose in the heat of this. You don't know enough about the virus. Having people out there cleaning all the time, not feasible when we're in the financial crunch we are. So I think we opened up one bathroom at the Parkway. At least I said we should. I know in Oneida Shores we opened up another bathroom. So I believe we've opened up more access to our laboratories at the parks. Not all of them opened up yet, and we're opening up, starting to loosen up some of the parking restraints we had there too. Still putting some restraints in, but we still have loosened up other parts. At Onondaga Lake Parkway, we're allowing more cars in now. So as we get into each phase, we'll try to loosen things up at the levels where we're comfortable. And so that's the plan there.
You'd mentioned a few things that came out of the call today from the regional control group. Anything else that came up or that you guys discussed?
Yeah, really what I think the guidance is really critical. I think as a region we now have had over 880 businesses attest to the Phase 1 New York Forward website. Guidance is important. Lingering issues, churches, restaurants, everything we talk about here, we talk about there. And I think it's a good venue because we're communicating directly with the state. But I think from the local level, we believe that we're on the ground level with this fight, and we have been. And some of the questions and/or concerns are specific and quite small. And I think at the local level, sometimes we just need to make some decisions. You can't. Nobody wrote the rules for this. And some of these small level type things, we know via common sense and experience how to make just make decisions and move forward. You can't micromanage a restart, and that's nobody's ever done this, so it's very hard. But I think that's for my colleagues, we know what the right thing is to do. If it's gray, you can't ask every time, because if you keep on asking, you don't get an answer. That's an answer to me, and you just got to lead and make the decision. Other questions? No other questions? Okay. I didn't really have any specific good news prepared today, Andrew, but certainly I hope our caseload is not a moment in time. I hope we have a new trend. We've had a couple nice days in a row, and I hope the real good news to me is the trend we're seeing related to our positive cases in senior-related facilities. There's a direct correlation to these cases and hospitalizations, which is a direct correlation to the ICU. So the fact that we're talking about 9 cases and cases under 20 really for the last 7-day average there, I think maybe we're turning the corner here on this in the most serious part of this fight, which has been keeping our most vulnerable safe and trying to prevent unnecessary loss of life. So I'd say the good news is the fact that our senior facilities seem to be turning the corner here, and let's hope that this is a sustainable trend. Thank you.